Well, this week, some of the first doses of Pfizer's COVID-19 vaccine were delivered to UC Davis Medical Center in Sacramento. The hospital got more than 4,800 doses and immediately started vaccinating their frontline workers there. So what was it like, not just to be the one on hand to when those vaccines were given, but also to actually be the person giving the vaccine? Dina Kupfer standing by with the critical care nurse Heather Donaldson with more on that. Hey, Dina.
Yes, good morning to all of you. So this is incredible. Heather Donaldson joins us via Zoom this morning. She's a critical care nurse at UC Davis. We've shown the video of those vaccines being administered the first day on Tuesday. Heather, you were the person behind the mask giving these shots. And so first of all, thank you for what you do. Thank you for being a frontline worker and one of our medical heroes. But what was it like? No pressure, right? All of those cameras on you as you were delivering those vaccines?
Yeah, so it was actually funny because I had no idea I was going to be giving the first dose, and I was preparing my station, and they sat someone down in my chair. I didn't know it was patient 0, and then the media started circling me, and yeah, that's a high-pressure situation.
No doubt about it. Yes, keep going.
Oh, no, I was just going to say, but she got her shot.
She sure did, and you delivered it. And so being a frontline worker yourself, you also received the shot that day. So I want to know how you're feeling, and I want to know if you've had any side effects and what your message is for other frontline workers who you believe should be getting this.
Yeah, so I'm not experiencing any side effects at all. I had a little tiny bit of localized injection site pain yesterday. I wouldn't even call it pain, more discomfort. Justin, my husband, is a respiratory therapist who also got his shot. I gave it to him, and he went skiing yesterday. So we're both doing fine. I also administered many vaccines yesterday and the day prior to medical professionals. And we didn't have any adverse reactions. We're asking everybody to wait for 15 minutes after their injection just to make sure. So I would say get your vaccine. It's better than rolling the dice with COVID.
Yeah, and I know you have seen patients who may have been in contact with someone who had COVID. You're an ICU nurse, of course. And so due to HIPAA regulations, we can't specifically talk about patients. But you did this to your husband. Clearly, you're passionate about making sure the people you love have been vaccinated and will continue to do so. But what was going on through your mind when you finally got word that this vaccination was coming to Sacramento, because you've been on the front lines and you've seen the dire side of this?
I personally felt relieved that we were going to get some help on board. We're experiencing a surge in the hospital and in the region and all over California right now. We're seeing, an increase of COVID patients in the hospital, in the ICU, and it feels like a little bit of a breath of fresh air to be able to have a vaccine available, to know that in about a month, we'll have 95% immunity, and our bodies creating antibodies right now.
Yeah, absolutely. Well, we are so grateful for what you do each and every day. I know you're going to be back at the table today delivering more vaccinations. So thank you, Heather Donaldson, critical care nurse at UC Davis. We appreciate everything you're doing.
Of course.
All right, John, back
I'm
over to you.
actually in the ICU today.
Oh, okay. There you go. Well, stay safe and well, my friend. Thanks for joining us.
I will.
That is great. Dina, thank you.